Okay, let's go ahead and move on to our 9:10 a.m. item, presentation of proclamation designating the month of May as 2021 Mental Health Month. Supervisor Scott will go ahead and present.
Thank you. Board of Supervisors, County of Lake, State of California proclamation designating the month of May 2021 as Mental Health Month. Whereas mental health is essential to everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives. And I'd have to say many of us have experienced that this last year. And whereas prevention is an effective way to reduce the burden of mental health conditions, and whereas there is a strong body of research that supports specific tools that all Americans can use to better handle the challenges and protect their health and well-being. And whereas mental health conditions are real and prevalent in our nation, and whereas with effective treatment, those individuals with mental health conditions can recover and lead full, productive lives. And whereas the Lake County Behavioral Health Services, along with each business, school, government agency, healthcare provider, organization, and resident, shares the burden of mental health problems and has a responsibility to promote mental health and support prevention efforts. Now, therefore, be it proclaimed that the Lake County Board of Supervisors does hereby proclaim May 2021 as Mental Health Month in Lake County and calls upon the residents, government agencies, public and private institutions, business and schools in Lake County to encourage our community to increase the awareness and understanding of mental health and the steps our citizens can take to protect their mental health and the need for appropriate and accessible services for all people with mental health conditions. Passed and adopted this 4th day of May, 2021.
Thank you very much. Any further comments? Wondering if we have Director Metcalf. Yes, we do, and he seems to be live on video.
Yes, thank you, Supervisor Scott, and thank you, Mr. Chair, members of the board, for reading this proclamation. I know you guys are tired of seeing me, so I've asked our clinical deputy director, James Isherwood, and possibly our mental health program manager, Ronnie Duncan, to say a few words about this. I think all of you saw, maybe yesterday, I sent out the first edition of our newsletter. Lake County Behavioral Services has put together a newsletter, which we're hoping to send out on a quarterly basis to raise awareness around not only mental health issues, but substance use disorder and homelessness issues. So I'm going to turn it over to James Isherwood. I believe you're here. Would love to hear from you, and or Ronnie, if you'd like to say a few words.
And Jake, if we can make sure, oh, there we go.
Well, I'll say something. Thank you very much to the board for recognizing Mental Health Awareness Month. It's really important, I think, especially this year with all the isolation and various forms of grief that people are going through, that we're recognizing mental health and supporting people through it. So thank you very much. And I think James has his hand up as well.
Yep, and there he is. He's unmuted.
Yes, good morning. Greetings to the board and everybody attending the meeting today. Wow, what a year we've experienced. The kindness and resilience of Lake County has never been more apparent to me than what we've experienced over the last year. And I feel like I would be remiss if I didn't give a shout out to the folks at Public Health and everything they've done to help us through this past year, including the disaster service workers that have helped. They say that this pandemic that we're experiencing, it's not over yet, is going to lead to a second pandemic related to mental health and behavioral health issues. We've been quietly preparing to receive the additional work that we're expecting. In the past year, the last 6 months of 2020, we saw an increase of inquiries for behavioral health services at 24% over the last 6 months of 2019, including an 83% increase in people who received a first service. So they were linked to a service. That was a huge increase over the last 6 months last year. And I don't think we've even scratched the surface yet. I'm not going to talk a lot about prevention. Next week is National Prevention Week for Behavioral Health, and we'll be back here at the meeting. But I want to remind everybody that mental health conditions can affect anybody. And 1 in 5 adults every year experience a mental health condition. And of those, 20% of those mental health challenges become serious. And when they become serious, they become ours at the county level. It's amazing what a good diet, good sleep, and some really good deep breaths every day can do for a person. And if we can all take it upon ourselves to learn how to support each other and mental health, the community can be there for each other. This month is sponsored by a variety of agencies nationwide. National Alliance of Mental Health or Mental Illness, otherwise known as NAMI, are putting out a message that you are not alone. Now more than ever, we need to find ways to stay connected with our community. No one should feel alone. If you or someone you know is feeling this way, you can call us at 994-7090 during business hours and be linked to our access team. After hours or in the event of a crisis, you can reach us at 1-800-900-2075. Thank you. Make it a great one.
Thank you very much. And we also have Jolene Treadaway, who wanted to make a comment.
Hi, yes, Jolene Treadaway, Redwood Community Services. I wanted to say that RCS is proud to be a partner with Lake County Behavioral Health Services. And I know that we share in our vision to live in a community where people feel seen, heard, and valued. And with that said, I wanted to thank our providers who are this last year especially have been having to reinvent the wheel of what does it mean to provide service to some of our most vulnerable populations, and have been showing up continually committed and dedicated to providing service to those in need. There is a great need and suffering among residents in Lake County who are experiencing mental illness, and that need is going to grow as we come back together in person. And so thank you to those who are on the front lines who are working with clients. Thank you to Behavioral Health Services for continuing to show up alongside us and with us. And I truly believe that our work will lead to people being able to live vibrant, healthy lives. And so thank you to the board for recognizing Mental Health Awareness Month.
Thank you very much for all of your comments. Appreciate the hard work that behavioral health has had to go through again during this pandemic, and looking to support and see what is needed to continue the work as we get out of this pandemic. Any other comment from supervisors before we move on?
Just that James struck it right on the head when he said it is about reaching out and checking in on each other. That's what we need to be doing now more than ever, checking on our neighbors. We've been isolated. If you're not seeing somebody that you normally see, go check on them. If somebody's not acting right, just go talk to them. And if, they need services, try to help them navigate the system to get the help that is needed. It's all about helping each other.
Thank you for that. Supervisor?
Yeah, I'd like to just follow up with that also as, there is still somewhat of a stigmatism on the mental health issues here in the United States, but, I just want to, send a message to anyone out there. Please reach out. There are opportunities, as you said, friends, family, other things. It's a lot of self-medication going on, and we're dealing with that here locally. I think, especially with our homeless population and others, but just throughout the entire county. So please reach out. Be brave. I know it's not easy, but there are support systems out there. But please talk about it, and there should be no stigmatism. Our health and our welfare as humans together, we can take care of. So I just think it's so important. We may have all, but I know I've had folks that I've lost in my life, sometimes a simple conversation might have changed the outcome. And I just want to let everybody know, don't let it be a stigmatism. I think anyone who reaches out is just brave to do so, and we just need to encourage each other. And that's all I have to say.
Thank you. Appreciate the comments. Any other comment on this before we move on? Thank you very much to the team.